Health Services has a number of programs, and we've had successes in each of those areas. And some of the highlights are Six Nations Mental Health and Addiction Services. There was an amalgamation of Six Nations Mental Health and the New Directions Group. And so they've come together as one department. The two-row on the Grand Canoe also had a 10-day paddle with staff, clients, and community members participating. Many community members also completed their different groups, which include Wellbriety, Ohahase Day Treatment, Grief Recovery, Relapse Prevention, Sewing Class, Elders Craft Class, Paint Nights, Life Skills Group, Good Food Box Cooking Group, Batch Cooking Group, and the Youth Summer Camp. Six Nations Mental Health and Addictions also held a client Christmas party for over 200 clients. The Home and Community Care Program completed the renovation for the kitchen at the J. Silver Hills Complex, and the animal control highlights were their pet wellness and spay-neuter clinics. They also had dog food days where they were giving away a bag of dog food to those who come every third Wednesday morning of each month at the Animal Control Center, which is located at the landfill site. At the Family Health Team, we saw the hiring of a new physician this past year with the Six Nations Family Health Team, which will provide further care for our community. At the dental program, after 40-plus years of service, Dr. Doug Crane and Iris McDonald, his assistant, retired from the Gagnon Center Dental Clinic. The replacements are Dr. Holly Nepanak and Savannah Sky. They will be taking their places at the dental office. And this school dental program has been in existence here for over 60 years. At the Birthing Center, we have the Healthy Babies, Healthy Children. The Birthing Center was featured on the front page of the Globe and Mail on July 23, 2018, outlining the work of the Aboriginal midwives, which includes the revival of traditional birth practices and medicines after many years of medicalized births. The Birthing Center was featured as a model of excellence, which can be transposed to other Indigenous communities across Turtle Island as an effective means to promote individual, family, and community healing and wellness. The Birthing Center and the Healthy Babies, Healthy Children program have worked seamlessly over the past several years to provide services, education, and support to families who are involved with child protective services. As a result, many clients have learned new parenting skills and personal life skills, which enabled them to maintain custody of their children and get on a healthier path. At the Child and Youth Team, the Children's Health Services expanded into the Child and Youth Health Team with funding from Jordan's Principal. The program grew from 6 to 24 staff and supports over 200 families. At the Ambulance Paramedic Station, we have 2 new ambulances were added to our fleet units, and there is increased community coverage by having 2 ambulances, 4 paramedics, staffed 24/7. Previously, we were only funded for 1 ambulance with 2 paramedics, and we also have 1 first response unit and 1 paramedic. The Diabetes Wellness Program has increased the chiropody services from 1 day a week to 2 days a week and expanded the role to include home visits for clients at high risk for foot ulcers and homebound. Health promotion and nutrition services have been working hard this year to include culture as a foundation in many of our programs, seeing an increase of land-based programs rooted in Haudenosaunee culture. Programs such as the partnership with the Good Food Box program, the Food Fit program, gardening, and food preservation programs, just to name a few. Check out the Winter Leisure Guide, which is to be released December 31st, 2018, for upcoming community programming and events this winter. Our therapy services team continues to support our community with physiotherapy, occupational therapy, speech and language services. They are also increasing outreach and prevention by incorporating new and innovative programming such as groups, camps, and partnering with teachers and other community members. Under medical transportation, we received funding to purchase 2 new wheelchair-accessible vans this year, and we're hoping to recruit 2 full-time drivers in the near future. Health Administration secured funding for a traditional detox and withdrawal management center, and they also secured funding for a new mental wellness team that will support agencies dealing with community-wide crisis situations. They secured funding as well for a FirstLink care navigator who will help families dealing with possible dementia or early onset Alzheimer's, and they will help them get connected to services. Our traditional medicine program implemented a youth leadership project to provide cultural training for community youth, and it offered a number of training opportunities to improve knowledge among service providers on our Haudenosaunee way of life and to support cultural safety for our people. Health also wanted us to give the following message now that the holiday season has officially arrived. The holidays are often seen as a joyous time and a time when we connect and celebrate with our family and friends. As the celebrations begin, it is important to remember that the holiday season can be a very difficult time for some. Loneliness, sadness, depression, financial issues, and increased expectations are some of the factors that may affect someone's ability to cope during the holidays. There's no easy step-by-step plan for coping during the holiday season, but here are a few suggestions on how to manage. Plan and budget to minimize financial issues. Be realistic, don't overindulge, and keep it simple. Limit stress by not taking on too much, and make a list and prioritize. Loneliness and isolation can be a concern for many. If you know someone that may be alone during this holiday season, please check in on them. If you're feeling lonely yourself, try to pick up a hobby or join a group. This will give you planned interactions and you may make some new friends. If you know that this is a difficult time for you, let someone know so they can check in on you. The holidays can also be a reminder of the loss of a loved one. Acknowledge that this holiday season won't be the same. Plan ahead to spend time with supportive and caring people who understand what you are experiencing. Some may feel guilty for celebrating in the midst of sadness. Well, this is normal. Acknowledge your feelings and do not feel guilty for celebrating. Be gentle with yourself. Take breaks as you need them. Breathe, cry, and laugh if you need to. If you need help, we have many hotlines you can contact. We have Six Nations Mental Health and Addictions, which is open Monday to Friday from 8:30 to 4:30, with walk-in crisis services available at 1769 Chiefswood Road in Ohsweken. Their phone number is 445-2143. We have Six Nations Mobile Crisis Line, which operates 24/7, 7 days a week. The number there is 445-2204 or 1-866-445-2204. Six Nations Social Services is also open Monday to Friday from 8:30 to 4:30 with walk-in crisis services available. They're located at 15 Sunrise Court in Ohsweken, and their number is 445-2071. Ganokosha Family Assault Support Services also has a 24/7 support line, and that number is 445-4324. Area code 519 for all those numbers. There's also some other lines that you can call, like the First Nations and Inuit Hope for Wellness helpline, which also operates 24/7. Their toll-free number is 1-855-242-3310. Or there is an online chat available, and their website is hopeforwellness.ca. And lastly, there's a kids helpline. Their call number is 1-800-668-6868, or you can text connect to 686868. They also have an online chat available at kidshelpphone.ca.